we really have a method that gets very good, credible pregnancy rates with these older women. And I call it Mini-IVF, minimal stimulation. It's controversial, but we've had great results with it. It originated in Tokyo, and because they can't do egg donation there, and so you have 47, 49-year-old women coming in saying, well, if we have any eggs at all, we want to take a chance and go through this. And it's so simple, it's ridiculous. It's Clomid based, and we keep them on Clomid for 10 days or until their eggs are ready, rather than the usual 5 days. And very low doses of gonadotropins, FSH, like 150 IU every other day, beginning day 3 or day 5. And if we keep them on the Clomid, it's very, very interesting. We get a very mild elevation of FSH. It would go down naturally if we just kept them on Clomid, but then we give them that little boost later on of FSH, and so their FSH level stays mildly but constantly elevated. And then we get a smaller number of better quality eggs. Furthermore, we don't really have to give them either antagonist or agonist to prevent premature ovulation. The Clomid does that. That's very innovative. The Clomid, we know, raises the FSH level by being an anti-estrogen and telling the pituitary gland there's less estrogen around. But the Clomid also tells the pituitary there's less estrogen around when the estrogen begins to go up at mid-cycle to stimulate a positive LH surge. So by keeping them on Clomid, we suppress the LH surge. And then we can trigger their maturation just with Lupron when their follicles are ready, which is a more natural way of triggering. And so we get very good quality eggs. And if she's 42 and she has a very low intrafollicle count, a case where you stimulate them and maybe you'd be happy if you got 4 eggs, and instead we stimulate them like this, and we get maybe even 2 eggs, but we get 2 blastocysts from those 2 eggs, and we freeze them. And because it's been so easy and so cheap for them, they'll come back next month, and we'll get 2 more eggs, and we'll vitrify those. And frozen is the same as fresh for embryos with vitrification. So we might save up 8 or 10 embryos before 6 months or a year is up. And we tell them, don't worry about transfer yet because you're getting older. You're 44 now. I mean, don't worry about the transfer yet. So then when they are either tired of doing this or we think they have a good number of embryos stored, we know the pregnancy rate per embryo is much lower, but we've got a lot of good quality, good appearing embryos. So then we begin to do the transfers in natural cycles. And if you can accumulate 10 embryos over the course of a year in a 44-year-old, you'll get a pregnancy rate that's not much different from a 30-year-old because you have 30-year-old one cycle, I mean. So we get 50% pregnancy rates if they're willing to put up with this. And because it's so inexpensive, they usually are willing to put up with this. So this, I call it Mini-IVF. I think it's very innovative for young women in their 20s. It's great because it's so cheap and they probably only will need 1 cycle, and that's it. And for older women, it's really good because we can store up more embryos and, and better quality embryos.